Good morning, students. In this video, we are going to discuss about health issues among adolescents, the part 1. The objectives are students will be able to define health, describe about the importance of adolescent period, enumerate the myths and facts about adolescent health, list down various health issues among adolescents, discuss about the lifestyle and routine related health issues in adolescence, and will be able to explain about reproductive health issues. Adolescence is the phase of life between childhood and adulthood from age 10 to 19. It's a unique stage of human development and an important time for laying the foundations of good health. During this phase, the adolescents establish patterns of behavior related to diet, physical activity, substance use, sexual activity that can put the health at risk now and in future. According to World Health Organization, adolescents are the greatest resource for a society to thrive. Investments in adolescents bring a triple benefit. Society recognizes adolescent as a stage of human development. They adopt healthy habits and teach others around them. Taking time in molding adolescents, instilling moral values, being a good role model to them would bring in positive character with traits such as compassion, respect, kindness, and humility that will help them to distinguish between right and wrong or good and bad. Ultimately helps to find happiness and success in their life and are clear about their life goals. And the triple benefit what we get is the healthy adolescents now, tomorrow they are the healthy adults and they bring forth healthy future generations. According to WHO, health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. What is adolescent health? It also comprises of physical, mental, and social domain. Physical, the person is able to adopt to regular pattern of eating, sleeping, exercise, etc. Mental, his thinking is right and good, and so is behavior and his emotional growth also. Social, he maintains good communication and so a good interpersonal relationship with his families, friends, and neighbors is established. Adolescent is the phase of new generation. We have already seen adolescence is the phase of life between childhood and adulthood from ages 10 to 19. It's a unique stage of human development and an important time for laying the foundation of good health. Adolescents experience rapid physical, cognitive, and psychosocial growth. During this phase, adolescents establish patterns of behavior related to diet, physical activity, substance use, sexual activity that can protect their health and the health of others around them. On the other side, put the health at risk now and in future. And all this could affect how they feel, think, make decisions, and interact with the world around them. So, it is considered health for the world's adolescents is a second chance in the second decade. The myths and facts about adolescent health. The healthiest stage of life is a myth. The fact is, death and injuries are common. They are in fact prone for death and injuries. In 2019, nearly 100,000 adolescents between the age group of 10 to 19 years died as a result of road traffic accident. Many who died were vulnerable road users including pedestrians, cyclists or users of motorized two-wheelers. Other leading cause are homicide, suicide, cancer, and heart disease. Can adopt a free style of behavior? It's a myth. The fact is, adolescents take steps to establish a behavior of its own, like talking politely and well, respecting elders and others, try to be friendly, good natured, easy to talk to, having a disciplined life related to diet, sleep pattern, for example, making a right choices of food, focusing towards optimum health. You would not eat over or less. Sleep pattern, establishing a good sleep hygiene. See to that he gets uninterrupted 7 hours of sleep. So these are the things he can establish and you would be able to establish as a pattern of behavior. Influence of environment is low. This is a myth. What is the fact? External influence is at its peak. Friends have more influence than parents. They want to do what their friends are doing, whether it's good or bad. Also, they get influenced by the schools, communities, media, and technology. Cultural influence is more powerful. Great opportunity for growth and development. It's a myth. The fact is, great opportunity to acquire life skill. Yes, it's wide open in the areas of communication, decision making, problem solving, critical thinking, creative thinking, team spirit, money handling, management of stress. Health issues in adolescent period. 1. Nutrition related health issues, lifestyle and routine related health issues, reproductive health issues, and mental health issues. What are the nutrition related health issues in adolescence? One is poor eating habits, eating disorders, and nutrition related issues. Let's look into poor eating habits. Knowingly or unknowingly, adolescents settle with certain practices and they find it hard to give up on those practices later. Sad that they don't realize the consequences too. For example, skipping breakfast would give rise to lots of health issues, whereas eating regular meals throughout the day gives the body energy and nutrients it needs to function optimally. Taking junk food on a regular basis leads to increased risk of obesity, could lead to respiratory problems, even breathing difficulty, and chronic diseases like cardiovascular disease, type 2 diabetes mellitus, fatty liver, and some cancers. And it has effect on reproductive system also. But a portion controlled plate, the portion sizes for filling is with foods from different food groups with right calories, protein, fat. Half portion of plate contains vegetables and salad. 1/4 portion contains good quality protein and it supports healthy growth and development and maintenance of body mass, and it contains all essential amino acids. The other portion is quarter plate, contains complex carbohydrate, the whole grain and fruits. Eating disorders such as anorexia nervosa, bulimia nervosa, avoiding food intake or restricting food, binge eating disorders. Here you see an adolescent having diagnosed to have anorexia nervosa. Anorexia nervosa, it's an unhealthy way to cope with emotional problems. It's an eating disorder. They equate their self-worth with how thin they are. They have intense fear of being overweight, and it is diagnosed mostly in girls. Symptoms include a bluish discoloration of the fingers due to lack of oxygen, thin hair, breaks or falls out, soft and fatigue, insomnia, dizziness, fainting, absence of menstruation in teenage girls. And here you see an adolescent having diagnosed to have bulimia nervosa, and you can see her engaging herself in binge eating, during which time she eats large amount of food and then purges using methods like vomiting, misuse of laxatives. Purge eating is often done in private. You can see us sitting in the restroom. They have mental health issues including anxiety, depression, stress, alcohol abuse, and self-injurious behavior. They present with discolored or stained teeth, calluses on the back of the hands or knuckles from self-induced vomiting, swelling in the cheeks or jaw areas, frequent weight fluctuation, and irregular menstrual cycle. What are the nutrition related issues? Coming to the body mass index. Usually they present with high body mass index with obesity. They are either overweight or underweight. Obesity is linked to insulin resistance. It leads to elevated blood glucose level, which can end up with type 2 diabetes, high triglycerides, low level of HDL, and high blood pressure. Lifestyle and routine related health issues. Physical activity. When there is a lack of physical activity, the adolescents tend to develop chronic diseases like hypertension, diabetes mellitus, cardiovascular diseases, whereas a physically active adolescents tend to be less obese, and so he doesn't get all these diseases which I've just now listed it out, and also they have better mental well-being. And people who are with sedentary lifestyle are more uh, need to be more conscious to have a good physical activity. And lack of routine, that is one of the issues. Sleep routines, for example, getting engaged constantly with catguts is one of the reasons could hinder their regular sleeping time. Morning they get up late, they have disturbed sleep, so they are tired, less stamina to work, and the whole day they are lethargy. They are feeling lethargy. So this is the problem. For 10 to 14-year-olds, the leading risks of health are related to water, hygiene, and sanitation, and also the other related behaviors such as alcohol use and safe sex. Taking less water than required leads to dehydration and so causes headache, fatigue, dizziness, constipation, dry skin, decreased urine output, and could end up with kidney disease or kidney failure. Not maintaining good personal hygiene. Another thing, taking bath daily, usage of right undergarments appropriate to the climate, preferably cotton cloth is the ideal for our climate condition. Washing and drying undergarments under sunlight, especially during menstruation. Take care to use clean uh, clothes. Also, selection of clothes, like for our country, especially Tamil Nadu and other places where humidity is more, jeans is not suitable to wear every time. Urinary tract infection, UTI, is a big nuisance, especially for girls, one of the most common conditions in teens. Drinking adequate amount of water daily, going to the toilet regularly and emptying the bladder completely can help prevent urinary tract infection. The symptoms: pain on the lower abdomen, fever, burning menstruation, urgency and frequency of urination, dribbling of urine. There are home remedies, personal hygiene, as I said earlier, lots of fluid intake, decrease carbohydrate intake. Let's see about reproductive health issues. Lack of knowledge and skill in initiation of sexual activity could lead to higher risk of unwanted pregnancy, unsafe abortion, sexually transmitted diseases including HIV and AIDS, and death. Polycystic ovarian disease, PCOD. Almost 1 out of every 10 teen girls has polycystic ovarian disease. This is caused due to hormonal imbalance. The ovaries produce excessive amounts of male hormones such as testosterone. The symptoms include irregular periods every few months they don't come at all, or too frequently they get, heavy bleeding, hair growth, weight gain, acne, headaches, darkening of skin. The treatment is hormonal therapy and lifestyle modification like making diet changes, regular exercises, etc. To conclude, growth during adolescent period is fast and intense, such as the growth in height, weight, which is caused by increase in bone, muscles and fat. Pubertal growth varies from individual to individual. Mostly they are genetically controlled, and so the changes in seen in emotion. Nursing student, it's her responsibility to take seriously the health issues which are common among adolescents, take time and effort to explain the growth process, helps the adolescents to know what to expect. Maintaining an open communication and being patient in understanding their mood changes, anxiety, which would certainly help adolescents to prevent and to manage common nutrition, lifestyle, and routine and reproductive health related issues. Thank you.